Bonjour tout le monde. Hello, everyone. Welcome to today's online event featuring a very wonderful, knowledgeable subject matter expert who will be speaking about professional interpreter services and how they support equity, accessibility, and safety in health and social services. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their cultures and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples, and their valuable past and present contributions to this land. My name is Andrew Tomeyer. I go by the pronouns he, him, and I'm the education coordinator with N4. I will be hosting and moderating today's today's webinar. My co-host is Mariah Maddock, who will be monitoring the Q&A box today. I'm pleased to introduce you to today's presenter, Allana Carlyle. Allana has been manager of the Language Access Interpreter Services with the Winnipeg Regional Health Authority since 2015. She initially joined the team in 2008 when she completed her professional interpreters training and was hired as an English-French health interpreter. Allana graduated from Université de Montréal with a diplôme d'études supérieures spécialisées, traduction anglais-français, and from the University of Winnipeg with a Bachelor of Arts in both études françaises and developmental studies. Allana participates as an expert on the International Standards Organization Technical Committee 37SC5, Translation, Interpreting, and Related Technology. She's chair of the Provincial Language Access Advisory Committee, chair of the Manitoba Government's Interdepartmental Working Group for Interpreter Services, and is a member of the Immigration Partnership Winnipeg Council. Allana is committed to working to support the delivery of safe, equitable, accessible public services for all language constituencies in Manitoba. Thanks for joining us, Allana. Today's session is being recorded and will be uploaded to our N4 platform. We'll share this with you as soon as it becomes available. Should there be any technical issues during this webinar, we will inform you with details for an alternate makeup session. Before we begin today's event, I would like to take a moment to introduce you to our platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same question or be interested in a particular response. Today, you have the option of upvoting a question. Please upvote questions you're interested in hearing the answer to, and we'll prioritize which questions that we pose to Allana first. And with that said, our speaker today has no conflicts of interest to declare. And so with that, I will pass the virtual podium over to Allana Carlyle. Thank you for joining us today, Allana.
Hello, everybody. Thank you so much to everyone at N4 for the kind invitation to be here today. It really is my pleasure to be joining you so that I can speak to you about how professional interpreter services do support equity, accessibility, and safety in healthcare. We're very lucky here in Manitoba that we have a professional interpreter services program incorporated into our health system. So I'm hoping today through this presentation to go over some of the history and development of our program, but also share some of our learnings with you. So it's really important to begin this topic by outlining the fact that there is overwhelming international evidence that outlines the risks associated in working with untrained interpreters and when we encounter language barriers, in particular in the healthcare system. So we know that language barriers, they contribute to decreased accessibility, more negative outcomes due to misunderstandings. Ultimately, this all contributes to increased healthcare costs because often service providers, in their effort to understand and communicate effectively with their patients or clients who don't speak English or the language of primary service delivery, they end up ordering more tests, having more appointments, going through all kinds of additional efforts trying to figure out what their patient or client is trying to tell them. Ultimately, this becomes a patient safety risk, right? If we can't communicate with our patients or clients, they are not safe, and neither are we. The evidence tells us that one of the primary risks that we encounter here with language barriers is actually around confidentiality and privacy. When we're working with an untrained interpreter, that individual might not have a good understanding of privacy and confidentiality. They might learn something in the course of their work, interpreting for a particular patient, and then go back and share that information with the community, not realizing the negative impact that might have. Another risk that we run into when working with untrained or non-professional interpreters is something called false fluency. So this is where sometimes when a service provider might pull in a bilingual colleague, asking them to act as an interpreter for a particular session. Now, our colleagues might be very highly trained professional individuals who speak two languages, and so we assume that they're going to be effective interpreters. But the evidence tells us that not everybody has the ability to do that mental transposition, the mental gymnastics required to deliver an accurate interpretation. And so the messages that are being delivered, we trust them to be accurate when that might not actually be the case. The evidence also shows us that untrained interpreters, when acting as interpreters, they may be relaying information that is not accurate, not fully complete in the message, or they may actually have a vested interest in the outcome of the appointment. So they might not have that impartiality that we really require, in particular in a healthcare or social services context. Now, evidence also demonstrates for us that when we have a professionally trained interpreter involved in an encounter, that it does support that equity, accessibility, and safety that we're looking for. So we know that it protects confidentiality. We have increased satisfaction and understanding from the side of the clients and patients, as well as the service provider. We have that enhanced accessibility and real client-centered services. We also know that we're increasing safety, equity. We're doing simple things like ensuring that informed consent, which is clearly a pillar in our Canadian healthcare system. Ultimately, a wonderful outcome of all of this is that it does lead to the enhanced utilization of healthcare services, because we're able to effectively and very accurately communicate and hear the messages from our patients and clients in order to be able to treat them safely and support them appropriately. So the title of this presentation was "What's in a Word?" And ultimately, the very simple answer to that is everything, because interpreters are supporting that safety, equity, accessibility. It's really key. Ultimately, none of the pillars of the strategic plan of our healthcare system can function appropriately without effective communication. And so we are so pleased when we have a professional interpreter involved who is an expert at all of these things and can support the safe delivery of healthcare services. So now, international evidence also supports the need and the importance of professional interpreter services. And I'd like to talk about a few of these points because certain role boundaries of the interpreter are important to note, because they might be a little bit different than what we have seen as service providers if we've ever had the opportunity to work with a volunteer or an untrained interpreter. It's also helpful to be aware that these role boundaries and best practices are supported by the international standards that have been published by the International Standards Organization in the areas of healthcare interpreting and interpreting, community interpreting as well. So to look at a few of these points in more detail, one of the pillars we have in the evidence-based role of the interpreter is around accuracy and fidelity. So ultimately, it's the role of a professional interpreter to interpret all messages and between two parties who do not share a common language. So it is their role to be interpreting these messages as accurately and as faithfully as possible. It's not the interpreter's role to add information, to change information, or to make it easier to understand. It is their role to interpret everything as the speaker has said it. Another point that's really interesting and often surprising for some folks is that it's not up to the interpreter to add any cultural information or explain things to the patient or client. Ultimately, we want all explanations coming directly from the service provider, who is the expert in that service delivery area. On the other hand, we also want all information about cultural practices to be coming directly from the patient or client. I don't want any of our interpreters making assumptions that everybody in a certain cultural community behaves the same way or has the same kinds of practices. So if we imagine for a moment a meeting or an appointment with a service provider and a client who does not speak the language of service delivery, we really want that service provider to be asking cultural questions directly of their client. The question is interpreted by the interpreter, and then the response is interpreted back. That way, all cultural information is coming directly from that individual. Another pillar in terms of the role boundary of the interpreter is around impartiality. The interpreter is there to be impartial or neutral. They're not there to advocate for either party, and they don't take sides with either party. They're also not going to give their opinion or engage in any way to direct the outcome of the encounter. They are there to be delivering those messages. It's also interesting to note here that interpreters will not engage in side conversations, but they will interpret everything they hear in an encounter, including those side conversations. So if we imagine, an encounter taking place and a colleague knocks on the door and sticks their head in the room and says, "Oh, your partner is online too. Can you take a phone call?" If the interpreter can hear that message, they are going to interpret it, even if it's not relevant to the conversation that's taking place. And the reason for that is because it's about equity. If it were an English speaking person sitting in that room, they would hear that comment and they would be able to understand. So the interpreter is going to interpret everything they hear in order to give that limited or non-English or French speaking person the full experience as an English or French speaking individual would, depending on the language of service delivery. Another key component about the evidence-based practices of an interpreter is really around that confidentiality and their role boundaries. So of course, interpreters, professional interpreters have been trained around confidentiality practices. They will keep all information they see and hear confidential. If they are taking any notes during the encounter, those are destroyed in a confidential manner before leaving the encounter. It's also not their role to fill out forms or do any of the extra administrative paperwork. Sometimes it's easy to want to say, "Oh, here, interpreter, help the client fill out this form." That's really outside their role. So a professional interpreter is going to very much respect and be aware of those professional role boundaries. Now, within our program here in Manitoba, we have a very specific set of code of ethics and standards of practice that our interpreters abide by and follow. And that helps guide them in the performance of their work and also helps support them in fulfilling those role boundaries and duties that I just explained. So the key components of our ethical principles within this document include these items here. So the accuracy and fidelity that we already talked about, confidentiality, impartiality, etc. Another aspect of the role of a professional interpreter that might be different than things that you may have observed in the past is the fact that a professional interpreter has been trained to do a full introduction in English and the target language at the start of their interpreting encounter. Now, this is really important because it helps set the stage on how they're going to perform their role and really helps the flow of conversation go more smoothly. So every interpreter will arrive on scene and introduce themselves by giving their name and who they're working for. They'll then explain a few additional points, including the fact that they will be interpreting in the first person. And this is really done to support direct communication between the service provider and their patient or client. So as an example, if we have a service provider, a doctor, for example, speaking with a patient, and the patient says, "Oh, my leg hurts," the interpreter is going to interpret exactly, "My leg hurts." The interpreter will not say, "She says her leg hurts," right? We really want the message to sound like it's coming directly from the speaker. So that supports that direct communication. As I mentioned already, the interpreter will advise all parties that they will be interpreting everything, including those side conversations. We want to make sure that's very clear for everybody right at the start of the encounter. The interpreter will reinforce their confidentiality and their impartial role. And in fact, to enhance that even further, they will make an effort to never be alone with the patient or client. So if the service provider has to step out of the room, so will the interpreter, because really there's no need for them to be there if there's no interpreted conversation taking place. The interpreter will explain that they will be taking some notes to aid their memory and that those notes will be destroyed in a confidential manner at the end of the session. They will also advise all parties that if they need to clarify for any reason, they will intervene with a hand gesture. And that's really important because we need everyone to understand that the interpreters are not walking medical dictionaries, right? There may from time to time be a term that they don't have an equivalent for in the other language. So in those moments, in order to be completely transparent and professional, they will intervene and state the interpreter does not have an equivalent for that term. Can you please explain? They will do that in both languages so all parties know what's going on. And then they will interpret the explanation of the term that's given by the speaker, just to ensure that full transparency and accuracy of the message. The interpreter during their intro will also ask all parties for permission to interpret. And this is really to empower everyone to make sure that they're feeling comfortable and are ready to proceed in a fully open manner during their encounter. So now that I've talked a little bit about the role of the interpreter, the language geek in me has to pause for a moment to present this little variation on our classic light bulb joke, right? So here we have, how many interpreters does it take to change a light bulb? And the answer, which I always giggle at, is none, because a good interpreter is going to add nothing, remove nothing, and change nothing in the message that they're delivering. So now that we've discussed a little bit about the role of the trained interpreter, I have some very simple tips to share for the service providers who are with us today who may be working with a professional interpreter in the future, because there's some ways that you can conduct yourself and some things that you can be aware of to help that encounter go more smoothly. So I mentioned already the interpreter introduction. So for service providers out there, please remember to introduce yourself and then to allow that interpreter just 1 or 2 minutes to do their professional introduction as well. That way all parties in the room have a good understanding of who they all are, what their role is, and how to proceed in working effectively together. Service providers are also encouraged to speak directly to their patients or clients, right? We want to make eye contact with them, speak directly to them, not to the interpreter who's sitting off to the side. We also want to avoid asking direct questions of the interpreter, right? We now know that their role is to simply be delivering those messages back and forth. So ask your questions to the client, conduct that appointment as you would, as if there were no interpreter in the room. This may be a simple reminder, but we want to speak clearly and slowly when we're working with an interpreter to help support them in doing their work effectively. It's helpful to use 1 or 2 sentences and then pause to allow the interpreter to do their interpretation. In a community setting, such as healthcare and social services, professional interpreters will most often interpret in what we call the consecutive mode, which means the speaker speaks a few short sentences and then pauses. Then the message is interpreted. And it goes back and forth, kind of like a game of ping pong. This might be different than what you've seen in large conferences or at the UN, where we have simultaneous interpretation taking place, where the interpreter is sitting in the booth with their headset and interpreting as the speaker speaks. So best practice suggests that in a community setting, that consecutive interpretation is most effective. So you can prepare yourself for that and use short pieces of information so the interpreter can retain that in their memory and then accurately deliver their messages. As service providers, we also want to try to avoid any technical terms, jargon, slang words, because these kinds of things are very, very challenging to interpret and often don't have an equivalent in another language. So if we can avoid those, again, that just minimizes any confusion that might occur. I mentioned before that the interpreter will intervene for clarification if they ever have a term they don't know, or maybe they didn't hear something clearly and they want to clarify that. So please be patient with the interpreter. It's not that they're trying to interrupt the flow. This to me really demonstrates their commitment to professionalism and accuracy when they need to intervene and make sure they're getting that message right. You will see interpreters taking notes for their memory aid, so don't be surprised by that. And also the friendly reminder that everything that's being said will be interpreted. The funniest example that I can come up with this piece is we had a physician at one time actually become quite surprised that her conversation that she was having with a student in the room was being interpreted, and couldn't understand why this was happening. But again, as I mentioned earlier, this is truly about equity. If the person sitting in the room were English speaking, they would be able to hear that conversation and understand what was going on. So keep that in mind as you're going through your appointment. I'd like to shift gears for a little bit now and talk slightly about the current context in Manitoba related to the delivery of interpreter services. So it might help to understand, first off, that the province of Manitoba is currently divided into 5 different regional health authorities, which you can see actually highlighted in different colors on the map here on the screen. So what might be very funny to see is that the Winnipeg Regional Health Authority, which I represent from Language Access, is the teeny little red dot there on the bottom. And although we are the smallest regional health authority from a geographic standpoint, we also serve the highest population as a regional health authority in Manitoba. In addition to these regional health authorities, which really are the service delivery organizations within our healthcare system, we also have another organization called Shared Health Manitoba. Now, Shared Health is responsible for leading the planning and coordinating the integration of patient-centered services around Manitoba, and they also deliver some province-wide health services also. So I mentioned already that my program, Language Access, we are a program within the Winnipeg Health Region. And I'd like to give you a little bit of history about how this all came to be, because it is quite unique as a model. And as far as I've come to learn, does not exist in the same way anywhere else in Canada. So for us, this all started back in 2004, maybe 2005, when the senior leadership of the Winnipeg Regional Health Authority really started to recognize those risks associated with language barriers and started to really see the changing communities in Winnipeg and across Manitoba. So they recognized that this was an issue that needed to be addressed. So at that time, a researcher was engaged to conduct an environmental scan, review evidence, and prepare an evidence-based model for interpreter services. So from that work, 2 reports were produced, which have acted as a guide for the development of our service over the years. Around that same time in 2006, a regional language access committee was also created. And this committee had representation from across all service delivery areas of the Winnipeg Health Region. And so these were stakeholders in the service who were going to continue to advise and guide the services being delivered by WRHA Language Access. You can see from this timeline that over the years, we started with a phased implementation of our service delivery. We picked to begin only 1 or 2 hospitals, which were identified as higher risk areas, and over the years slowly added more and more service areas until interpreters were available far and wide across the health system. As that was happening, what also occurred is that other external government departments, organizations, and agencies started to see the work that was being done by our professional interpreters and decided that that would be really helpful in supporting their work as well. And other folks wanted access to our team of trained professional interpreters. So we started back in 2012 expanding our services and delivering interpreter supports outside of the health system also. So around that time, we also created an interdepartmental working group within the Manitoba government with representatives from Justice, our Department of Families, our Department of Finance, Education, Health, etc. All the areas where a limited or non-English speaking individual may need to go to access their health and social services. And we did this to make sure that as we delivered services to these areas, we had a key place where we could connect and talk about quality improvement techniques, share ideas, brainstorm collectively. Since that time, these committees have evolved to have more of a provincial scope. So back in 2015, we also started delivering our professional interpreter services outside of Winnipeg to all the other regional health authorities across Manitoba. We wanted to leverage the resources that we had in Winnipeg to support further. And so our interpreters started working remotely by phone, by video conference to support some of our rural communities in Manitoba as well. Next steps for us, which is really exciting, is it has been planned that our program, Language Access, will soon be transitioning to the Shared Health Organization, which is really going to be a good fit because it represents and reflects the provincial scope that we already have. Now, I mentioned at the start of that little timeline that a researcher was engaged to propose a model for the delivery of interpreter services in Manitoba. And what I have here are some of the key components of those recommendations, and which have now led to the model that we use today for the delivery of interpreter services by Language Access. So one of the key recommendations was that interpreters needed to be accessible in the healthcare system in particular 24/7, right? Because we know that emergencies occur evenings, nights, weekends. Interpreters needed to be available to respond. We also didn't want to have service providers needing to remember a whole list of different phone numbers of who to call depending on the language they needed. So in Manitoba, we have coordinated with some different partners to make sure we have full coverage and interpreter support for all 4 language constituencies that we see in our province. So we have a department within the Winnipeg region that supports Indigenous health services. And the interpreters working in Indigenous languages are trained in the same way as all other language groups. We also have our official languages. So we work very closely with our French language service partners. We have the deaf and deafblind community. So there's an agency here in Manitoba that delivers sign language, ASL interpreter services to the deaf and deafblind communities. And then we have the Language Access Program, which I'm representing today, to support interpreters for all of our newcomer immigrant refugee languages. So we've developed one centralized phone number that coordinates all those different services. So a service provider can call one number and be automatically directed to the service they need depending on the language they require. Another key piece to the evidence-based model was that we needed to have professionally trained interpreters. Being bilingual is not enough to be a professional interpreter. And I'm going to speak more in a moment about the training that our interpreters receive and who they are. It was also identified that we needed to base our work on a code of ethics and standards of practice, which I had showed you earlier as well. There was those 9 ethical principles that really guide the work that our interpreters do. Another piece that's very interesting is the costs related with the delivery of interpreter services. So because WRHA Language Access is a program within the Winnipeg Regional Health Authority, we have a budget for the delivery of interpreter services. And we are so fortunate that we receive this support from the WRHA and from the Department of Health in Manitoba. Because we have this centralized budget, it means that whenever an interpreter is sent to an appointment that is covered by our Manitoba health system, so a publicly funded health service, there is no cost to the service provider or to the patient or client to receive the interpreter service. That comes from our budget. To extend outside of health, we now offer our services on a cost recovery basis. So if we're sending an interpreter to another government department or external agency, they can still access our team of trained professionals just on that cost recovery service. This is not a business venture of any sort. So we can keep the cost very low and make it as accessible as possible. As I mentioned, we also, in our evidence-based model, received support to have these provincial committees to make sure that we have stakeholders engaged with best practices and quality improvement within the language access team. So right now, I'm very proud that our team is comprised of 93 professional interpreters. These are all casual employees, actually unionized employees, who work with the Winnipeg Regional Health Authority. We currently offer services in 36 different languages, which are all listed here. And I love to show this slide because I think it's absolutely fascinating how these languages really reflect the changing face of Manitoba. For each of these languages, we know that there's a community here somewhere in our province that is requiring this service. And I just love to see this diversity up on the screen. Our team of professional interpreters have been trained to deliver a variety of services. So in addition to the face-to-face or the in-person interpreting that they provide, they also provide message relay and reminder calls. So this is something as simple as having an interpreter call a limited or non-English speaking person and tell them about their upcoming appointment, because they might not even know that an appointment has been booked for them. They can also remind the patient and introduce themselves by phone to reassure that individual that they will have an interpreter present for their visit. Our interpreters also work remotely, so they provide services via conference call, by video conference, and they also do something called sight translation, which is a very interesting aspect of our service. A sight translation is an oral rendering of a written document. So we know in the healthcare setting in particular, we have lots of patient education materials, consent forms as well, right? So if we have a limited English speaking individual who needs to give informed consent, the interpreter has been trained to take that consent form, which is often written only in English and French, and read it out loud in the target language so the patient can hear that information and give their consent accordingly. In addition to our team of trained interpreters who are employees of the WRHA, we also have a formal contract with a third-party provider called MCIS Language Solutions, and they provide over-the-phone interpretation in over 200 languages, and this is available on demand with an average connect time of usually less than 2 minutes. So this is a really fantastic complement to the services we offer. Whenever we can't get one of our own local interpreters to an appointment, this is a really great backup plan, or for those emergencies where we need an interpreter right now and we can't wait for an interpreter to travel to a site. So we are so lucky to have this partnership with MCIS. So I mentioned earlier that I wanted to tell you a little bit about who our interpreters are and how they came to join our team. So it's a really important aspect of quality for us that we go through a very rigorous recruitment, screening, and training process before hiring our staff interpreters. So we start by doing a standard paper screen and telephone screen with all of our applicants. Applicants are then sent for an interpreter skills assessment. So we use two different tools, one called the ILSAT, another called the CILISAT test. The CILISAT, just to give you an example, is an acronym that stands for the Community Interpreting and Interpreter Skills Assessment Tool, or I'm sorry, Community Interpreting and Language and Interpreter Skills Assessment Tool. So this is a tool that's been developed that's really used to evaluate an individual's ability to interpret accurately without any omissions or distortions to the message. So they go through that assessment. And in our experience, although the individuals we select for this test are often very highly trained individuals, professional backgrounds from their home countries, very fluent in English and their target language, we still only have approximately 55% of the individuals we test who are successful with this, which really outlines and supports for us the fact that being bilingual, again, does not automatically make somebody an interpreter, right? So we take those folks who are successful and we go through a personal interview. During the interview, we ask some very pointed questions, trying to make sure that this is a good fit. The role boundaries, the professional interpreter role boundaries, are something that these individuals will be able to follow. At that point, folks who have been successful with all of those steps are selected to join our interpreter training program. Our interpreter training is offered once per year and is a 72-hour program. It really focuses on the code of ethics and standards of practice for interpreters. We go through many ethical dilemmas, explore rule boundaries, do some case scenarios and studies, and really trying to make sure that our interpreters, when they're done, have an excellent understanding of the core competencies required for professional interpreters in Manitoba. At the end, we test them again based on the training material with both a written and an audio test. And at that point, folks who have completed all of that screening and training are hired as employees to work as staff interpreters with WRHA Language Access. We support our team the best we can with ongoing professional development as well. So we have staff meetings every 2 months where we invite guest presenters to do targeted professional development about different areas of the health or social service system, because we want to make sure our interpreters are always learning and continuing their journey. In addition to the training, the core training that I just talked about, we also have some advanced interpreter training modules in the legal and the education sectors as well, so that we can support our interpreters who are doing their work outside of the health system. So I put this slide up here for those of you who are interested in data and numbers, because this is something we are also quite proud of. When Language Access first launched our services back in 2007, 2008, we just proudly patted ourselves on the back when we processed 426 interpreter encounters. You can see that over the years, the demand for this service has increased exponentially. And over the last few years, we've processed over 30,000 interpreter encounters each year, which again, just makes my heart feel happy, because it means to me that service providers are seeing the value in this service, and that we're able to support so many encounters where limited or non-English speaking individuals are seeking help from our health and social service system and are getting that support that they need. A little bit more data to show with you for those of you who are interested. This just outlines our top most frequently requested languages. And this, of course, is very unique to Manitoba. What I've come to realize is that in the different contexts we have across Canada, the demand for languages is very different. It's also important to note that this information includes languages handled by my program only, Language Access, which does not include our Indigenous languages or our sign language interpreter requests. So this is simply our newcomer immigrant refugee languages reflected here. So it's important also to be aware that Language Access has mechanisms in place to collect ongoing feedback from clients, WRHA senior leadership, service providers, everybody. We feel that it's really important to have that ongoing quality monitoring, and we have a variety of quality indicators built into our processes so that we're always evaluating our services. One component of this ongoing evaluation is that we have an interpreter self-assessment tool where we encourage our staff interpreters to regularly review their code of ethics and assess their own performance against their training and those performance expectations. Our interpreters also have regular opportunities to debrief with myself, with other leadership within our team. And we actually have annual performance conversations. So I book an annual meeting with each one of our interpreters so that we have a chance to meet one-on-one, and the interpreters have the opportunity to share their own experiences with me about how their work is going, any challenges they've encountered, their success stories. And these meetings, I have to say for a moment, I absolutely love these because it's so validating for me to hear about how the interpreters feel that they are contributing to the health system and the positive impact they're having on both patients and clients within the system. I can share, one story here for a moment. During one of these meetings a couple of years ago, I had an interpreter tell me a success story. And she shared that she had been scheduled to interpret for a female patient who was seeing a doctor. And this patient brought along her husband and felt more comfortable having him act as her interpreter during the appointment. Now, although we felt that that was unfortunate because we wanted the professional interpreter to take on that role instead, the physician agreed to let this happen, but the interpreter stayed in the room to support the conversation as needed. So that was the scenario with this particular encounter. Now, the interpreter relayed to me that the appointment started and the conversation began, but more and more frequently, the husband, who was acting as the untrained interpreter in this setting, kept getting stuck on words. And although this individual, he was very, very professional and a highly trained individual in a different industry, clearly didn't have the training and that medical background. So kept looking to the interpreter for assistance on certain medical terminology. The interpreter was so able to be effective and clear and accurate in the support she was providing that eventually the husband just said, okay, never mind, will you please take over and do all the interpreting for me? And by the end of the session, he said to the interpreter, please, we want you to be our interpreter at all of our appointments. And they've been working with our interpreters ever since. So it was a pleasure to hear that story, because we could see at the beginning of that appointment the hesitancy to let the interpreter take over, but then those clients, that couple, definitely saw the benefit of having the professional interpreter there. That then allowed the husband to be there as a support person for his wife, rather than taking on that added burden of having to be the interpreter and be thinking on his feet. He could be there to support her instead. Another interpreter shared with me a story about interpreting again for a patient and a physician. And at the end of the encounter, this time it was the physician who said, "Oh, I am so happy you were here, interpreter. I wish somebody had called you in, so long ago. I've actually met with this patient on 4 different occasions already, and I could not figure out what was going on. And I have been so worried about my own ability to provide safe care to this individual. Now I hear exactly what's happening, and we have a care plan in place." So I share those success stories because, again, it just warms my heart to hear these things. And although these may seem like big events or big stories that the interpreters decided to take away and share with me, I know that these kinds of things are happening every day, where the clients turn to the interpreter at the end and say, "Thank you for being here." And that just really reinforces the work that our entire team does on a daily basis. So in addition to those feedback and performance conversations from the interpreters, we have a feedback form available on our website where patients and clients or service providers can submit feedback. We also have immediate on-demand phone interpretation available to our patient relations office. So if ever a limited or non-English speaking patient or client or family member wanted to report some feedback, they could get an interpreter on the line to be able to do that effectively as well. So all of these strategies contribute to our ongoing quality monitoring, which is such a key piece of the work that we do. So although we have so much to be proud of, and I've spoken about the success and the unique model and program we have in Manitoba that we're very proud of, I also acknowledge that there are always opportunities for improvement and next steps to take. So to share some of those learnings and next steps with you, I can identify that in our over 10 years of experience, what we've seen as one of the biggest barriers for clients to access professional interpreters is often a lack of awareness from the service providers in the system. So some folks out there still think that it's okay to just speak more loudly or wave their arms around, and that's helping effective communication, which we know doesn't work, right? So one of our key goals moving forward is always to enhance education for our service providers so that they can have a better understanding of the importance of working with professional interpreters and the evidence that supports that strategy. The more they're aware and they see the value in that, the more often they'll take the extra step of arranging the interpreter to support the encounters that they're having with their patients and clients. In the Manitoba context, of course, we also want to continue to build our capacity to support our partners in rural areas. So right now we're doing a lot of work with remote interpretation, but we would love to see that expanded to have a more equitable model for service delivery across the province. We're always evaluating our services to ensure sustainability, right? Sustainability of our human resources, but also our financial resources. So we need to make sure we're always leveraging what we have in place to try to expand the services, but making smart decisions about that as well. Next steps for us also always include workforce development. So we need to continue to invest in our trained professional interpreters to make sure that they continue to be engaged and putting their best foot forward in the work that they do. We are just so proud of our team, and so they are our biggest resource, and so we want to make sure we're continuing to support them. So there's lots of room to grow as we continue to learn and expand and enhance our service delivery. So that concludes the more formal portion of my presentation. Again, thank you very much, everybody, for joining me. And I'm very happy now to answer any questions. I've seen some things pop up in the chat, so I'm happy to hear from all of you. Thank you so much.
Yeah, thank you. Thank you as well, Allana, for such an excellent presentation and sharing your a very interesting perspective that's a very clear necessity in healthcare and in social services. So I learned a lot relating to this major element with working with newcomers. And I hope that the audience today has learned that this as well. And as you mentioned, we did receive a few questions here, and our first two questions are along the same line, so I'll kind of combine them into one. So when working with different language clients over the phone or in person, it can happen that interpreters and callers, or interpreters and the clients in the room, might go on having an exchange without pausing. How can the host of the conversation interject and steer the conversation back to interpreting? As well as what else do you suggest as to appropriate behaviors that the physician or the settlement worker or et cetera should do in such a situation?
This is a very timely question because I actually had the opportunity just last week to have a conversation on the phone with a client and an interpreter, and that exact same thing happened, unfortunately. And so the first moment that it happened, I found myself feeling a little bit timid and I didn't want to interrupt, and as I could hear this exchange proceed. And then I decided that I shouldn't feel that way, and we really want to be having our primary goal to be that enhanced communication. So I politely interjected and just said, "Excuse me, I understand you have lots of important messages to share, and it's important that I hear them. So can we please give the interpreter an opportunity to interpret to make sure that I'm hearing everything that you need to say to me clearly?" And so I was hoping that that was a respectful way. I mean, I did interrupt, but I was hoping it was a respectful way to interject and remind the two parties that if the interpretation is not happening and they're having a side conversation, that we're really not achieving our goal of having that three-way conversation together.
Of course, thank you. And thank you for sharing that answer. And thank you for the question. So we have another question with respect to, sorry, let me scroll up. With COVID-19, many services have had to move to online services to continue providing their services well. How has your organization adapted to the pandemic?
Well, like all services, it was a shocker for us right at the beginning. The interpreters were very disappointed to see many of their face-to-face in-person assignments canceled or changed to a remote delivery option. So, however, I'm very proud to say that since day one of the pandemic, we have continued to provide interpreter services for all encounters, but have really encouraged service providers to shift to a remote delivery. So we've said that face-to-face is always still available in those situations where it is critical for patient safety that it continue in person. All of our interpreters received full training on the use of personal protective equipment and routine practices, infection prevention and control. So they know how to gown up. They have their N95 masks if they need to go into those scenarios. But we did our best to encourage folks to work remotely whenever possible to keep all parties safe. And so we learned a lot about the delivery of video conference interpreting, just like we're doing now. We've seen an increase in demand for that. And I think that it's been a fabulous learning curve for us because I'm sure some of this virtual work is not going to go away. So now we've just had that added skill in our portfolio of being able to work very effectively from a remote standpoint, but also in person when required.
Thank you. Is it appropriate to give feedback to providers if they've committed a cultural faux pas?
I would say that it's not the role of the interpreter to do that. So it would really only be the service provider, the client, and the interpreter in that room. And because the role boundary of the interpreter is just to be delivering the messages of the speakers back and forth, I would say it's not, the interpreters are not going to speak up and do that. They would see that as outside their role boundary to providing feedback on a service provider's performance. However, if there are service providers out there who question their skill level in that set, I would certainly suggest that they're welcome to reach out to me after this webinar, or if they have local professionals in their respective areas who work frequently with newcomer groups. That way you can do your own self-study and development in that area just to enhance your cultural awareness and competency.
Thank you. Thank you. So interpretation services can vary across Canada tremendously, especially between provinces, within urban versus rural areas, ranging from some services such as yourself in Winnipeg and across Winnipeg, to essentially almost none within very rural, remote areas. Is there a way to advocate for a national standard across Canada with respect to providing interpretation services?
I think, I like that idea so much. And my colleagues that I have, my counterparts in different provinces, talk about this often because we certainly see that there are gaps. And so I think that one of the ways to advocate to, our senior leaders who have power to implement these kinds of programs is really to share the evidence, right? Some of the evidence that I presented today. This isn't just my idea or something that someone in Winnipeg came up with. We have leverage for the service because it is an evidence-based model. And again, being supported by international standards, right? So I know that previously, I think Andrew, you had even posted some links on how to access the ISO, the International Standards Organization, publications around some of this. So if we collectively take that evidence and use it as backup as to why this is so critical and link it directly to risk and safety, that is really how we were able to take off here in Manitoba. So that would certainly be a recommendation.
Thank you. And to the audience, we have in our resource toolkit, and we'll be providing this after as well, links to various different resources, including the website to review and purchase the ISO standards at your organization, if you so would like to. And thank you, Allana. Any tips for encouraging patients who are reluctant to use interpreters, who feel they are bilingual but have reason to believe they aren't understanding patient instructions?
So if I'm understanding that question correctly, we're thinking of a scenario where the patient themselves speaks some English and wants to communicate themselves in English or the language of service delivery, but the service provider is seeing that there's maybe a bit of a barrier there still. So in these situations, what we do is we recommend that a professional interpreter can still be present to support the conversation, but that simply means the interpreter is maybe going to sit in the waiting room, even maybe not even in the encounter room where the encounter is taking place, so they can be pulled in if we see that there's a gap. We never want to take away a patient's autonomy, and if they want to choose to communicate in English, we certainly want to support that and make them feel as comfortable as possible. But we can remind them that the professional interpreter has been trained in things like medical terminology and their code of ethics. They are confidential and will not share the information outside of the encounter in any way. Sometimes allowing the interpreter to do that professional interpreter introduction in the target language also helps because it sets the stage and offers an opportunity for the interpreter to sort of connect briefly with that client as well. So if some of these strategies are sometimes helpful in putting the patient more at ease to allow the interpreter to be present, either for the full encounter or for part of it at the end, just to do a little recap as necessary.
So providing that sort of environment of trust and assurance that everything that's going to be discussed in the room will be kept in the room, essentially.
Exactly.
Yeah.
Yes, because that's a key component, right? So many of these communities can be very small, tight knit, and so we need, just as much as we need service providers to understand the confidential and impartial role of the interpreter, the clients need to understand that as well. Otherwise, they're not going to feel comfortable disclosing anything with the interpreter present. So if we do our best to support the client's awareness of how the interpreter will perform their role, that might help as well.
Of course, thank you. And so we have enough time for probably 2 more questions. The following question is: interpreters witness a lot of sad stories and could suffer from vicarious trauma. Are there any opportunities to support them, or what sort of services are available to support them in the Winnipeg Regional Health Authority or through language access interpreter services?
Yes, and this is so critical. So thank you for this question. It's really important that we take care of our interpreters because you're right, they are going to hear and see a lot of very sad information, and of course are then delivering these messages in the first person as they interpret, which can be especially poignant for our team. So yes, we do have ongoing debriefing opportunities for the interpreters. They can choose to debrief with me as their manager or our language access coordinator. We also try to work with other service providers. Other specialty teams may have their own debriefing sessions, and we ask them to invite the interpreter to join those debriefing sessions to be able to speak freely within the healthcare team. In addition to that, though, the biggest resource we have is that all interpreters are provided access to the Employee Assistance Program through Manitoba Blue Cross, which is available to them at no cost and is professional counseling services in a variety of areas for the interpreters and their families as well. So whenever an interpreter needs that heightened level of professional support themselves, they have that opportunity as well, which is really critical. We try to really advertise that or encourage our team to access that resource. It's so important that they stay healthy and take care of themselves first.
Thank you. Thank you. Yes, of course. The other question, do you have or know of a counterpart organization within Ontario?
So in Ontario, there are a few different organizations that provide professionally trained interpreter service as well. That's maybe something that I can compile a list of and reach out to some of my counterparts to then post online later in the networking area, Andrew. I would hate to leave some out now as I'm thinking on the spot, so I can make sure that I collect my resources and share that after today's session.
Of course, that sounds great. Feel free to add them to the meeting place on our N4 platform. And one final question. With respect to the recent Afghani crisis occurring in Afghanistan at the moment, have you seen any, or are you prepared for an influx of Afghani refugees, and what preparations have been made with language access interpreter services to meet the needs of this potential influx?
Of course. So I mentioned during my presentation a couple of committees that I'm a part of, one being the Provincial Language Access Advisory Committee. And as part of that committee, we do have a representative from our immigration department, our immigration branch within the province of Manitoba. And the role of that individual is to keep us up to date with what's going on, any expected new arrivals, numbers, dates, etc., so that we can do our best to prepare for these things. So we have been working very closely with the province around what's happening in Afghanistan and what we can expect here in Manitoba. So we do have some interpreters on our team who will be able to interpret both in person and over the phone, certainly, to support any new arrivals that we see here.
Thank you. No, that sounds very great, and the services you provide are excellent to Manitoba or to Winnipeg, and very much look forward to continuing this conversation as this webinar concludes. So with that, before we go, are there any final words that you would like to provide to the audience before I wrap up this discussion today?
Well, I would like to, thank you, Andrew and Mariah, everyone at N4 again for the kind invitation to be here. It's really a pleasure for me. To any of our interpreters who are on the line today, you are truly superheroes, and we appreciate all the incredible work you do. Thank you.
Thank you. Thank you very much, Allana, for taking time to participate in today's presentation and providing your insight and experience. And many thanks to you, the audience, for joining us today. You are welcome to join us again for any of our upcoming events as well that are here on the stream. And if you missed any part of today's presentation or would like to watch this session again, we will be posting this recording to the N4 platform within the next week or so. We want to continue the dialogue that this webinar has started, so we'll be moving all these questions that haven't had a chance to be answered to our meeting place on the N4 platform. We have invited Allana to respond to your questions here, as well as provide the input with respect to various different organizations that you'll look into and such. So thank you for that too, Allana. We've also curated several resources that Allana has provided, as well as from our resource toolkit on our N4 platform. And you can find these in our resource toolkit, and we'll be linking them when we share the on-demand version of this presentation. So if you haven't yet, please sign up to newcomernavigation.ca for all our resources and learning opportunities. Along with that, following today's session, you'll be invited to complete a survey to share your feedback with N4. These surveys help us continuously improve and seek out new webinar content and opportunities that are responsive to topics that you are interested in. We kindly ask that you follow the link and complete this brief survey. Thank you once again, everyone, for joining us, and we hope that you can join us again at a future N4 event. Once again, Allana, thank you very much, and we hope everyone stays safe and stays well. Have a good day.